going to call the meeting to order. Please rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Catherine, would you please take the roll?
Yes. Director Wallace?
Present.
Director Stewart?
Present.
Director Danielson?
Present.
Director Ethan?
Present.
And we're waiting for...
Dr. Nicholson's on his way.
Yes.
Okay, so we wanted to start the meeting. Nancy, would you please take over?
Yes, we wanted to take the meeting somewhat out of sequence and begin with our recognition of Al Nagy. We have a commendation for him. Having been elected as the new mayor of Newark, he's stepping down as our chairman of our development corporation. And we have a special resolution recognizing him. I wanted to talk for a few minutes about his stewardship of our development corporation. He became chair in 1986, and he's been in this position until he resigned in January of this year, having become elected mayor in the city of Newark. As chairman of the development corporation, he's been part of many of the district's most important strategic initiatives, and among them are the Washington Outpatient Surgery Center, which opened in May of 1986, our medical billing unit, which was established in 1989, our physician recruitment program, which was established in 1991, along with Washington Associates. The Washington Outpatient Rehabilitation Center opened in June of 1992. The Washington Clinic in Fremont opened in June of 1993. The Ohlone Student Health Center opened in March of 1996. He also was here for our occupational medicine program, which was established in 1996 in December. The Washington Clinic Fremont opened at Washington West in 1998. Our sports medicine program was established in January of 2001. The infant development program was begun at Washington Clinic in Newark in June of 2001. We opened a new Washington Stanford Radiation Oncology Center in October of 2001. The Washington Clinic in Warm Springs was relocated in January of 2003. Washington on Wheels, our mobile health clinic, was licensed in March of 2003. Little Washington Township Child Care Center, which is also under the Development Corporation, opened in July of 2003. Bras for Body and Soul, which serves our cancer patients, opened in February of 2004. The Nakamura Clinic in Union City opened in January of 2006. We had a change in our relationship with our outpatient rehab center, and that occurred under the auspices of the Development Corporation in February of 2006. We had a new partnership and renaming of our Washington Radiation Oncology Center in February of 2006. We also implemented the image-guided radiation therapy program at the Radiation Oncology Center in February of 2008. We acquired land for the relocation of the Newark Clinic in February of 2009. We did the build-out of 3575 Beacon Avenue for the diabetes program in January of 2010. Also the build-out of the Civic Center site for the wound care and hyperbaric oxygen treatment program in April of 2010. We restructured the Washington Outpatient Surgery Center, again under the Development Corporation, in June of 2010. And also the development of the Washington Township Medical Foundation, of which the DEVCO is the corporate partner, in June of 2010. And finally, in December this year, we relocated this past year the Newark Clinic to its new site on Thornton. And he has been at the helm of the Development Corporation through all of those moves, acquisitions, changes, and new developments. And our resolution for him tonight reads, in recognition for his years of dedication, caring, and commitment to the community, Washington Township Healthcare District wishes to formally recognize and acknowledge the years of service of Al Nagy on the Washington Township Hospital Development Corporation Board of Directors. Mr. Nagy has served 26 years as the chair of the Development Corporation Board, furthering the mission of this district. During his years of service, the DevCo Board of Directors, Mr. Nagy has been instrumental in furthering DevCo's relationship with other partners, including the Washington Outpatient Surgery Center, the Washington Radiation Oncology Center, and Washington Township Medical Foundation. With highest regards and accolades, we proudly present this formal commendation and deep appreciation in honor of Al Nagy. Duly bestowed on Al Nagy this 8th day of February 2012 by the Washington Township Healthcare District and Washington Hospital Healthcare System. Mike, you have the resolution?
Yes, before I present the resolution, I just want to say that when I came on the board in 1990, Mr. Nagy was there with the DevCo, and we pretty much wore him out, I think, if you've heard all of the list of things that Nancy was talking about. But all kidding aside, Al, the services that the DevCo have provided are priceless, and the revenues that the DevCo has brought in to support the mission of the district has been not just important, but critical to our success in serving our people. And we cannot thank you enough for your years of service and your leadership. So thank you, Al. Get to retire to being the mayor. Yeah.
Have you ever known a bashful mayor? I would like to thank the Board of Directors of the Washington Hospital District for this honor and for the honor of being able to serve you for the last 26 years. It's been a singular pleasure of mine, but it's one that I've totally enjoyed, mostly because I happen to serve for two great organizations, one the City of Newark and the other the Washington Hospital District. And one of the reasons what makes it so pleasurable is the staff that we serve with, our fellow board members that I serve with, and it has been truly a pleasure. It really hasn't been a lot of work. It has been mostly pleasure, so thank you.
I don't know if you want to take a short break, but there is cake over to the right to commemorate Mr. Nagy's years of service.
Would you
Take a quick break.
Yes, let's take a 5-minute break or 10-minute break. You ready?
I am now.
Okay, everyone, we're going to reconvene the meeting. And Nancy, would you please take over for the education session?
Yes. This evening, we're going to have a session presented by our Director of Food and Nutritional Services, Kimberly Alvari. And I wanted to tell you a little bit about her. She received her undergraduate degree from Cal Poly in San Luis Obispo. She graduated magna cum laude. Her postgraduate work was done at the University of California in San Francisco, where she was named the Bay Area's most outstanding dietetics student. Her early professional career as a registered dietitian includes positions at the University of California at San Francisco's Medical Center and as a consultant to Home Health Plus. Her years at Washington Hospital began as a clinical dietitian with a focus on critical care patients. The last 10 years have been spent in management of the clinical staff and most recently as our food service director. She's a member of many professional organizations, including the Academy of Nutrition and Dietetics. When she's not found here at Washington, you will find her out on the road, either running or walking her new puppy. With that, I'd like to hand the meeting over to Kimberly.
Thank you very much for that nice introduction. I am really excited to be here tonight because It is National Heart Month, and I'm excited to have a heart-to-heart conversation with you this evening about all the nutrition programs at Washington Hospital. When I started to get this presentation together, I started to realize just how many expressions there are about the heart. And I'm one of those kind of people, if you hear a new expression or a new word, you try to work it into the conversation as soon as it's appropriate. Sometimes it takes me a little longer than others to get it in, but I usually can get that accomplished. Tonight I thought it would probably be my best chance and probably one of my last chances for a while to work in some of those expressions. So with that said, I have my heart set on providing a heartfelt presentation that comes from the bottom of my heart and gets to the heart of the matter of nutrition at Washington Hospital, and I cross my heart not to have a change of heart about any of it. Check. Okay. February is American Heart Month, and heart disease is still the #1 cause of death here in the United States. Every 25 seconds, someone will have a coronary event, and every minute, somebody will die from one. The good news is a healthy diet and lifestyle are the best weapons that we have to fight heart disease. And so this talk tonight makes it very appropriate that we're talking about nutrition during National Heart Month. I have a heart healthy agenda for you. I want to tell you that the focus tonight has an overlay or an overtone of heart health, but I want to tell you that the programs that we run happen 365 days a year. We're doing it year round. The face of the program may change, and as we move into March, we'll go to National Nutrition Month, but I will be sharing with you a lot of the things that are happening this month because of National Heart Month. I'm going to start with a little background on the food, which will set the table for when we talk about patient care and nutrition. We talk about the hospital cafeteria, and then I'm going to wrap up a little bit with the community nutrition. I'm going to flash this up. I won't read you our mission. I just want to show it to you really quickly, and then I want to show you our vision. And why I do that is because those few words convey our overall purpose and our commitment to this community in the nutrition work that we do. And all of our decisions on what we do are based on evidence-based research, and that evidence-based research directs our choices in terms of the food that we buy, how we prepare it, and how we serve it. We absolutely believe that the word healthy and taste good belong in the same sentence, and we work to demonstrate that every day to our community. These are some of the conscious decisions that I'm talking about, the one decision at a time from the field to the fork that we look at. When we start to talk about having an excellent culinary experience, we have to align the ingredients we select with the cycles of the season. So we really focus on local and seasonal vegetables and organics, and local can't be local enough because what you're looking at here is our own urban garden in the back of the hospital, and that garden helps subsidize the produce and things that we have in the cafeteria for our patrons of the cafeteria. These are some more of the conscious decisions that we have. A lot of the conscious decisions we make based on nutrition, as well as the impact on the environment, as well as society. So if there's fair trade coffee, trans fat-free hormone milk, which is new to us, cage-free eggs. We compost 111 tons of compost, recycle all of our cooking grease, which is trans fat free, no genetically modified foods, and we do have an exclusive line of healthier dessert options from a local bakery. And we decided to do that because we felt that when you put healthy, like we said in the same sentence with tasty, we needed to come up with something that we could put on the patient's menu that really represented that. So we went to a local bakery and we developed our own line of sinless dessert options. We have a chocolate sinless cake. We also have a beet cake, which will be coming onto the menu soon. We also have whole grain cobblers, fruit cobblers that are on the menu. So we're really excited about being able to partner with that bakery as well. Okay, we talked about getting the right ingredients, but it's also about the preparation of those ingredients. So it's pretty much a science project in the kitchen when we get together putting the food together. We have these specialized recipes that are in a format that have really all the standard operating procedures, which is the SOP you see on there, and then we also have critical control points. And those critical control points are what allows us to ensure, and those standard operating procedures, that we have the best nutrition and that the food is safe and that we have good quality. We have over 100 recipes like that. When we start to look at patient care, we think of food as medicine. Most of you recognize the chicken breast, probably there on the right-hand side. When I start thinking about food, I see the picture there here on the left-hand side, which is the amino acids. So more than 100 of those would probably make up that chicken breast. And so when we're talking about, again, prescriptive appliance of these diets to the menu, this is what the TLC diet looks like. That is the Therapeutic Lifestyle Changes Diet, which is put out by the National Cholesterol Education Program by the NIH. So you can see that food really takes on a prescriptive look to it. This is quite a prescription that we have to apply to our heart-healthy diets in the hospital. In addition to all of these, there's additionally a sodium restriction, trans fat limitations, and there is also a focus on whole grains that we look at when we're talking about cardiac health. But we have these for all of our diets in the hospital. So here's a good look at how that prescription, how does that prescription translate to a patient menu? We have over 100 items on our patient menu. We also have an everyday alternative menu to even extend that so patients can find things that they enjoy on the menu. But actually this week is what we'll be featuring next week on Valentine's Day. We have a special celebration menu that we will have. And so I'll give you a little picture of that. It is a butterflied chicken breast there, piccata, which is a light version of that, some fresh asparagus, and also polenta heart in the shape of a heart with some sun-dried tomatoes to make it red a little bit on the top. And while the heart looks fun, we have a mission with that heart. That's a whole grain, and so that's a way to work in whole grains in the diet for our patients while they don't even know we're doing it. Here's some more ideas, additional heart-healthy menu ideas for patients. We have egg whites or an egg substitute, but we actually make egg white omelets for the patients. We have non-fat dairy products. We have a organic and vegetarian yogurt that we serve, lean cuts of meats and skinless poultry, the salmon, the trout, and the tuna. The recommendations for the therapeutic lifestyle is that you have 2 servings of fattier fish twice a week. So we have on our menu salmon that is a teriyaki salmon, reduced sodium salmon teriyaki. We have herb-crusted trout. We also have salmon stuffed with spinach, and we also have the tuna on the menu. So we offer a lot of that for our patients. Our seasonal fruits and vegetables, the whole grains, and then we have a large vegetarian menu, hummus wraps, tofu. We have a large line of East Indian vegetarian meals as well. And then we have our sinless line of desserts. This is our quality control. I talked about the fact that we don't send food if we don't like what it tastes like. So if we don't like it, patients don't get it. We taste all of our food before it goes up to the patients, and we'll send it back if we need to send it back or make corrections before it gets out of the kitchen. Here we are tasting some of that food. We have another layer of quality control on our foods as well. It's called culinary rounds. We have one of our chefs and a registered dietitian have scheduled times that they go up to the patient care units where they share that food, that therapeutic menu and the food with the staff on the floor and get feedback on that menu and any ways that we can actually improve that menu for our patients. What are people saying about the food? What are the patients saying? Great menu, food's perfect. Food I received has been outstanding, flavorful, satisfying, and the variety is very impressive. You can see all of these nice comments, and we really enjoy getting those comments because it affirms that we're meeting our mission and our vision. But what I want to point out to you are the words that are in bold and underlined. And those are the comments that we get about the service that we give. And we're just as proud of those comments because we believe that a little empathy and caring go a long way in healing the heart. You might need education on therapeutic diet. They look kind of complicated if you look at the guidelines they gave you for the TLC diet. So here's a picture of some of the registered dietitians we have. Registered dietitians are the nutrition experts. They have 5 to 7 years of education, specifically in nutrition. They pass a national test, which they have to maintain their credentialing with ongoing continuing education. And Washington Hospital employs 11 of these nutrition experts. Going to move into the hospital cafeteria. All the great things we do with food and education that we do with the patients, we think we should bring into the cafeteria. So we do that by supporting local, state, and national initiatives and programs. Of course, this month is National Heart Month, and I'm going to give you a little bit what's going on here at in the cafeteria. Next month, we'll move to National Nutrition Month. We've done More Matters, which is a focus on eating more produce, a government program. Save Lids to Save Lives was last October in Think Pink and Breast Cancer Month. And like I said, this month in the cafeteria, some of the fun things we're doing to pass on education is we have decorations up, we have healthy literature out for people to pick up, and then we have featured items that are heart healthy. We have a Sweetheart Special that is designed by the registered dietitian. We have Wake Up to Wellness items that are on the menu as well that people can get. And then we have the sinless lines of quick breads and muffins and whatnot that people can get instead of the traditional, donut and whatnot in the cafeteria. During this month, people can pick up a Smart Heart card. If they purchase any of the heart specials that we have, they get credit for that. We punch it. They turn their card in at the end of the month, and there'll be a drawing for a $25 gift certificate at a local restaurant. And I'm going to tell you a little bit more about that restaurant because that's coming up a little bit more. We're also working on the nutritional analysis of the cafeteria menu. We're doing a lot of recipe updates. We're really looking at increasing the number of healthy items that we have in the cafeteria. And we're doing nutritionals on basically over 500 items. It is an arduous project, but we believe in it. We think we want to get this information to the people that come to use the cafeteria. And you'll see on here a San Jose State University little emblem. And I put that up there because we have a relationship with San Jose State where we help train the nutrition students that come from there. And right now, they're working on this project for us. They've probably put in over 6 months already. I have a graduate student and I have a PhD candidate doing that. And it's Phoebe Signer and Heidi Weil, and I'd like to really give them thanks because it's a tremendous load of work that they're doing, and they really have the expertise to help us with that. I'm going to move into the community. Nutrition doesn't stay within the walls of the hospital. We need to move into the community and do nutrition there. And I'm going to show you how we care for the community. And I guess when I look at this list, I'd say, how do we not care for the community? Outpatient nutrition counseling year-round, a weight management program that's focused for women the right way, and the Right Track support group given by Anna Mazet. Nutrition lectures in the hospital and the community. And if you really like that prescription that I gave you on heart health, I invite you to come next Tuesday to listen to Lori Ruffleson talk about the application of that diet. Support groups. What support groups do we not do? Parkinson's, stroke group, cancer, breast cancer, all the support groups. Specialized programs, the women's program here, where we do talks, and we also do cooking demonstrations often in their Heart Healthy and other cooking demonstrations that go on there. And we actually just had a cooking demonstration this month, February 1st, on cutting the salt but saving the flavor in your diet. So other specialized programs. Cardiac rehab, pulmonary rehab, all of those programs. Health fairs and career days. We're at a career day just yesterday at Newark High. We've been doing that for years. Health fairs, Costco, Mission San Jose High School last year. Job shadow, year-round. We have people interested in nutrition who come and visit us and try to learn about the field of nutrition in our department. Mentoring students from Irvington. I'm getting tired. Mentoring students from Irvington High on senior projects. We have a current student right now who's helping with community programs for pediatrics and obesity, and we have a student that's really interested in that who has been assigned a dietitian to help mentor him. And if that's not enough, you can always download our healthy recipes from our website. This is, I want to give you a little taste, a little flavor of the cooking classes, because this is Anna Mazet, and she's wildly known for these cooking classes, and people really like them. So I wanted to give you a little flavor. I'll set up the clip. It's just a quick clip. She's doing a healthy class on healthy foods for tailgating. And I guess we probably could have used that a week ago, but...
circles and squares. And I think that it would be good to also use different shaped pretzels and get them unsalted. And with nuts, you can also buy those roasted and unsalted, and the flavor is still going to come through.
So if you miss any of our classes, or you miss a cooking class, or I started to tantalize you into wanting to see those, you can always go to the hospital website and you can look and find some of the lectures there online that you can watch, as well as the cooking classes. I want to bring up one other program. It's an infusion program. It's our outpatient program that opened in December. And we're really, really proud of this because Nutrition Services worked directly with a focus group that Nancy put together to give us feedback for the kinds of foods and things that we would provide there at the infusion program. And so we really have put together what we call our signature line of nutrition items for that infusion program, and all the feedback that we've received on that so far is that it's been very well accepted because it was specifically picked out by our community and provided to them. Healthy dining. I told you I was going to talk more about that restaurant that they're going to win a gift certificate for. It's $25 for Strizzi's. We invited local restaurants in this area to participate if they wanted to provide some entrees that the dietitians could look over, do the nutritionals on, and then maybe make a recommendation. Strizzi's agreed to do that with us, and so we're able to recommend at Strizzi's just across the way here a grilled chicken with a mango salsa, and also a grilled salmon with a virgin olive oil tomato salsa. So the people, when they dine in the cafeteria and they get credit for that, they also have the chance to dine out healthy at Strizzi's and earn that $25 gift certificate. And here I'll just tell you, this is Stacy Silva, the chef at Strizzi's, and it's Maggie Villa-Gomez, one of our dietitians. We also know that eating healthy starts with having food on the kitchen table. So we're really proud that last fall we were able to partner with Kellogg's, and what we did is in the cafeteria, for every bowl of Kellogg's cereal that was purchased, Kellogg's matched that, and we were able to donate 1,440 bowls of cereal to a local food bank here for our community. I'm going to start here by just showing you a few of the pictures of some of the food service staff, and I want to do that because these are the people that make everything that we do happen. And I didn't even talk to you about the catering that we do. So these are some of the faces behind all of the work, and I mention them because I think of them as our everyday heroes. These are people that quietly go about doing their business of incredible work for this hospital. And I also want to say that I'm very grateful and I'm thankful to be responsible for the food service department here at Washington Hospital. I'm so blessed to come to work every day, to have a job that I really, really am passionate about and enjoy just as much. I'd also, I better not forget this. I was going to say I want to thank the management team at Washington Hospital Food Service. I don't have their pictures, but that would be Alfredo Macias, Elvis Lavaretta, Aditha Hernandez, Bibiana, I feel like I'm at the Emmys, Bibiana Machete, and Scott Garcia. There we go. So that said, that pretty much wraps up National Heart Month. I hope you enjoyed it. I hope you stop by the cafeteria and take a look at some of the things we're doing. And if you don't have time for that, we have in the back some of our sinless almond blueberry coffee cake that's made by the local bakery for you to sample. Thank you very much.
Thank you. Thank you. Any questions or comments? Anyone? Thank you. Thank you, Kimberly. Okay, we're going to move on to the consideration of the minutes of the past meetings. May I have a motion for approval of the January 11th, 23rd, 25th,
So
and
moved.
February 2nd meetings?
So moved.
Second.
We have a second. All those in favor?
Aye.
Opposed? Motion passes. Okay, this time we're going to move into communications. Are there any oral communications this evening? We do have some. Okay. Because of the length of the agenda, we're going to limit the time for speakers to 3 minutes. So please be as brief as you can. And we will start off with Domenica Gonzalez. Please. Good evening.
Hi, my name is Dominga Gonzalez. Hello. I've worked as a telemetry tech for about 15 years at Washington Hospital. I worked as a per diem for 2 years before having a full-time position, and the great benefits that we have here. I've always been proud to work here at Washington Hospital, and I've always felt that the hospital recognized hard work of all of us into making the hospital what it is today. But we've been negotiating since June, and we haven't had very good progress. And 2 weeks ago, management decided to change the language in our contract, adding tandem benefits that could threaten the job security that I always thought I had for me and my family. Now, what I had always been proud of has kind of made me very concerned. I'm disappointed by our proposal, and I just hope that Washington Hospital does the right thing for all of us. Thank you.
Thank you, Domenica. Thank you. Next, Annabelle Torrio.
Good evening. My name is Annabelle Torrio. I work at the EBS department, and I'm also in the bargaining team. I work for Washington Hospital for 6 years now. I was per diem for 2.5 years. We all look forward for our benefits. We are all hard workers that deserves respect with good benefits and fair raises. All of us work hard for this hospital to be where they are now. All of us work as a team for Washington Hospital to be in the status they are now. 8 months now, we've been bargaining on the table. 2 weeks ago, management came to the table with a package deal that includes changes to tandem benefits that will or may hurt us in the future. Last December, I was here standing in front of this board panel to urge the hospital to bargain in good faith. Now I'm here again. We, as workers of Washington Hospital, deserve a fair raise with no takeaways.
Thank you, Annabelle. Next, Axon. I'm going to slaughter your last name.
It's okay, it's one of mine.
Okay. Thank you, Axon.
Folks, practice. Hi, like my sticker? It's pretty cool. The sticker says Unite for a strong contract. That started today. Our members are out here in front of the hospital, right, urging the hospital to negotiate fairly and settle this contract. We've been at the tables now for 7 or 8 months. I was here in November when the super committee wanted to cut a whole bunch of money from Medicare, right? Would have impacted public district hospitals like Washington. There's opportunities for this hospital and our union to work together. That was one example, okay? Whether it's with the education fund, development of staff here, or this ongoing, fight against Medicare and Medi-Cal cuts. We can work together on that. Our union, SEIU-HW, is launching 2 very exciting ballot initiatives here in California this year, including one, the Charity Care Act, okay? That would require nonprofit hospitals, right, to make sure they do their fair share to care for the needy, folks who are underserved. I know Washington Hospital does a good job at that. Last year, I believe you spent $44 million on charity care. These are opportunities that we can work together, labor and management. But right now, we can't do that. Why? Because we have this ongoing contract dispute. This contract dispute that would lead to labor disputes. What happened here today outside, you'll see our members uniting around this contract fight. We want to be able to work with the hospital in settling this contract. We want to work with the hospital on other things. There's opportunities for that. So I hope the hospital, Washington Hospital, the board of directors will do the right thing, remove this very hurtful proposal to our bargaining committee, to our members, this changes to the tandem benefits treatment. I believe that's the, if the hospital removed that proposal, we could settle this contract. Thank you for your time. Have a good evening.
Axon, can you tell me the name of the bill that SEIU is introducing in Sacramento?
Yes, the first one is the Charity Care Act. The second one,
Is it a Senate bill or an Assembly bill?
I actually forgot that.
Okay.
It's not off
I
the
can
top
get
of my
that
head.
from you later
And the
then.
second is the Fair Pricing Act, I believe.
The what?
The Fair Pricing Act.
Fair pricing. Thank you.
Thank you. Have a good evening.
Thank you, Axon. Thank you. Are there any other speakers tonight? Okay, we will now move to the written communications. Hello, Dr. Romano.
Hello, Mr. Wallace. Members of the board, I'd like to present for your consideration the credentials action items from the medical staff from January. There are 3 appointments. Jonathan Bradley, anesthesiologist, to the provisional active staff. Clarabelle Taylor, a gastroenterologist, to the provisional active staff. And Mary Maish, a thoracic surgeon, to the provisional active staff. For reappointments, we have Naveen Paul Bhatti, emergency medicine active staff. Shelley Bodnar, family medicine active staff. Stephen Chan, DDS dentistry, to the courtesy staff. Excuse me. Tamara Cheney, family medicine for the active staff. James Cohn, ophthalmology active staff. Ricardo De Rosa, medicine oncology, courtesy staff. Vijaya Dudiala, Internal Medicine, Active Staff, Stephen Friedkin, Pediatrics, Ambulatory Staff, Angeline Hadiwijaja, Pediatrics, Active Staff, Ash Jain, Cardiology, Active Staff, Romesh Japra, Cardiology, Active Staff, Vasdeep Kalan, Psychiatry to the Courtesy Staff, James Lilja, GYN Oncology, Active Staff, Lehua Liu, Internal Medicine, Active Staff, William Nicholson, Cardiology, Active Staff, Eva Quiroz, Infectious Disease, Active Staff, Ranjit Reen, Internal Medicine, Active Staff, Mary Ann Sardamaduro, OBGYN, Active Staff, Barry Shibuya, Rheumatology, Active Staff, Shenfeng Shi, Internal Medicine, Active Staff, Devinder Singh, Internal Medicine, Active Staff, Clifford Wong, Nephrology, Active Staff, and Casey Zheng, Family Medicine, Active Staff. Dr. Clifford Popple was previously on the conditional reappointment. We'd like to grant full reappointment with privileges as indicated through 11/30/2013. He's an anesthesiologist on the active staff. Yungting Liao in pediatrics, we are recommending advancement to the ambulatory staff in pediatrics. Finally, there are 3 resignations. Lawrence Bubb, a teleradiologist for change in practice, Scott Mack, OBGYN for a change in practice, and Jan Segnitz, also OBGYN for medical disability. Any questions? That's the end of my report.
Thank you, Dr. Romano. May I have a motion for approval of the credentialing action items?
Move to approve as presented.
Second. Okay, we have a second.
Mr. President, I'm going to abstain as you're acting on my privileges.
Thank you, Dr. Nicholson. Dr. Nicholson is abstaining from this. Okay, all of those in favor? Aye.
Aye.
Opposed? Motion passes. We're going to, before we move on to the next part of the meeting, we are going to, again, adjust the agenda and move up the consideration of the appointment of a Development Corporation board member. As you saw earlier tonight, Mr. Nagy retired from our board and leaving a vacancy, and we have considered a new board member. And Nancy, would you like to discuss this further?
We've asked Russ Blowers of Newark if he would be willing to serve on our Development Corporation Board of Directors in place of our friend Al Nagy.
Okay.
And I had the opportunity to meet with Russ earlier this week, and I feel very strongly that he's highly qualified to be a Development Corporation board member and would be a real asset for Washington Township Healthcare District. So I'd like the board to consider his appointment.
Okay.
Mr. President?
Yes.
I move for the appointment of Russ Blowers of Newark to the Washington Township Hospital Development Corporation Board of Directors for 2012.
Thank you, Dr. Stewart. Do we have a second?
Second.
Any questions or comments? Okay, all those in favor?
Aye.
Opposed? Motion passes. Welcome aboard, Mr. Blowers. Thank you for serving. Okay, Dr. Romano, back to, I'm sorry. I'm sorry, boy. Maria, don't be mad at me. I apologize. Maria, please.
Okay. A pleasant good evening to everyone. Tonight, I would like to share with you the Service League activities in advance. 1. Washington Hospital Service League Nimble Timbles Quilters present Happy Scraps. Our wonderful ladies from Nimble Thimble Quilters will be having a drawing for the quilt called Happy Scraps. The fabrics were donated by the quilters, hospital employees, and members of the community. The Service League would like to take this opportunity to thank these wonderful and sweet ladies who gave their talents, time, and most of all their hearts putting these scraps together of cloth together and creating this wonderful Happy Scraps quilt. They are Marge Trebotich, Donna Bergener, Lillian Dawson, Betty Jacobs, Marilyn Prowse, Edwina Trussell, Cass Imish, and if I have not mentioned your name, you know who you are. Thank you very much. Proceeds will be Proceeds will benefit Washington Hospital Service League Scholarship Fund. The drawing will be held at the Service League annual meeting, February 13, 2012. Second is the Washington Hospital 57th Annual Meeting. The Service League is very busy right now preparing for the upcoming Washington Hospital Service League Annual Meeting, scheduled on Monday, February 13, 2012, to be held at Washington West. The Service League Board is excited about their annual donation to the hospital, and I can't tell you the amount yet because it's a secret for now. So you have to find out on Monday when you attend the annual meeting. Washington Hospital, new slate of officers. It's that time again where the new slate of officers is nominated to the board, and some of us in the present board will step down. I remember about 2 years ago when NUMI, the company that I worked for about 20-some years, when they closed, and I started searching for a job, I came across Washington Hospital Service League volunteers, and I immediately applied to become one. By serving our hospital community, you gain good self-esteem, love, and respect for others, and experience in a healthcare environment. This is why I'm sharing this to all of you out there. This is one journey in my life that I will treasure and be proud of forever. Thank you very much. And on this note, please allow me to thank all of you, the board of Washington Hospital, the Service League volunteers, for trusting me and allowing me to share my services and experience to our community. Thank you. And as a volunteer, we inspire by example because it truly reflects the power volunteers have to inspire the people they help, and as well as to inspire others to serve. A heartfelt thank you very much. May God bless us all. And this concludes my report for tonight. Thank you very much.
Thank you,
Good
Maria.
evening.
Thank you for your service. Dr. Romano?
Okay. The following is the medical staff report. We currently have 11 pre-applications in process, representing a broad array of specialties. There are 4 applications at present being processed. There are 3 applications which were acted upon earlier this evening, and tentatively 3 applications scheduled for next month, interestingly enough, all in pediatrics from different groups. There are no temporary privileges being processed. And finally, the overall look at the medical staff. The medical staff and allied health combined, there are 528 individuals that we're responsible for in the medical staff. 505 of those are medical staff individuals, 23 are allied health. And of those, 397 are active or provisional active. Thank you. That's my report.
Thank you, Dr. Romano. Ms. Farber?
Get to the calendar. Let's see, well, why don't we start first with the construction update? We'll have Ed speak.
Let's talk about, let's start out with the, as we usually do, the central plant, and we're down to very few things here. What's interesting about these 2 photos is this is the old generator room, and we have moved the transformers for the normal power into this room. They did complete this in a month. Those things are now energized, and we have to complete a few things like some fan rooms and closing in of the walls, and then we'll be able to connect those into the main switch room of the hospital. So hopefully by this time next month we'll be talking about the normal power coming in through in this manner to the main hospital. Other things just in terms of the central plant, you know, emergency power has been provided for the last 2 months. We now provide softened water, and we also provide hot water from the plant. And this Friday, all the rest of the utilities have been have been made operational and are ready to be commissioned and providing their services to the hospital. And this Friday we have our final OSHPD sign-off. So this Friday we should have steam, heat, air conditioning, everything operational and tied into the hospital. So we're nearing the end of everything with this part of the project. This, just very quickly, is the CJR. I want to just point out that this section of the project is the connecting hallway, and that is nearing completion. Both ends of it have fire exits for this building, and that work, or those exits, are being finalized and completed, and the sidewalks for those exits also being poured and completed. We've talked about the garden and the paving going on out there, so that continues to go on. That will probably be the last thing in this building that is completed, is all the work. But this is moving nicely and progressing nicely. This gets you a shot pretty much of the first floor so you can see that the first floor of the building is very nearly complete. Most of the finishes being put in place, and things like baseboards and epoxy and things like that going on along baseboards. So it's really just the fine tuning. This is a shot of what we call the multi-purpose room, which will be both a physical therapy space and a dining room. That's pretty well completed. This is actually a shot of the corridor leading from the main nursing area to the hallway back to the main hospital. And this is a shot back. So this is as you're walking into the unit from the hospital. This is the view you get as you're coming onto the unit. This is a shot of the nursing station, main nursing station. And this is a shot of the second floor. The second floor is still, the latter portion and the last thing to be done in the building. But you can see that finishes and things are getting in place, but we still have a fair amount of infrastructure work going on in there. And this is a shot of the basement, so you can see the basement also getting its finishes and coming along. We still have, the contractor still has a final completion date of April 24th that we are pushing them to meet, and so it looks like occupancy at this point probably very late in May. Okay. Any questions?
No, thank you, Ed.
Thank you.
Exciting, seeing the final touches being put in place. We'll go back to the beginning of January, and on the 12th, we had our Washington Township Medical Foundation Newark Clinic open house. And this is our new Newark clinic. And this was our grand opening. We had about 100 people in attendance. On the 17th, we did community education on how does aging affect your brain. Donna Schemp, who's a licensed clinical social worker from the Family Caregiver Alliance, presented this program. And we've partnered with the Family Caregiver Alliance as part of a series of seminars that are made available for caregiving for the older adult. There were 55 people in attendance. On January 18th, we had a program in the Women's Health Center, Exercise for Your Health. And they discussed several types of exercise from a woman's perspective and the health benefits of each. We had 15 people in attendance. On January 19th, we had a program called Nursing as a Career. And Doug Van Houten, RN, and Jennifer K. Brown, RN, Noor Zareen, RN, and Gina Malfati, RN, presented this program to our Medical Explorers group. I don't know how many of you are aware, but we have a very active Medical Explorers post here at the hospital. It's probably the most active one in Northern California, and Chris Lavoie is the advisor for that program. On January 19th, the 20th, we did a career and resource fair at the Fremont Adult School. There were 200 people in attendance. On January 21st, we had a program with our Speakers Bureau, and the subject was osteoporosis and blood pressure, and what you need to know. Dr. Barry Shibuya, a rheumatologist on our staff, presented the osteoporosis portion of the program, and Doug Van Houten presented on blood pressure. We had 50 people. On January 25th, the Speakers Bureau was active again with a program on heart and stroke health. We had 25 people in attendance, and this presentation was made at the Buddhist Temple in Union City. Doug Van Houten presented this program. On the 1st of February, we had more community education, and the subject was, are you having trouble falling asleep? And Dr. Verma, our sleep medicine physician, presented this program. We had 54 people in attendance. That's a good group. He discussed sleep patterns and the causes and treatments for sleep disorders. He also shared insights on how to get a good night's sleep. On February 1st, the Women's Health program presented the program that was mentioned earlier by Kim Alvare, Lose the Salt and Keep the Flavor. We had 21 people in attendance. On February 2nd, we had a program for diabetes, Getting to the Heart of the Matter, and Dr. Ash Jain, cardiologist and medical director of our invasive vascular imaging service and medical co-director of our cardiac care service, spoke about the relationship between diabetes and heart disease. We had 29 people in attendance. On February 7th, we were at Newark Memorial High School for their 7th annual career fair. We had 57 people in attendance. And Patricia Danielson, our board member, was there representing the field of registered health information. On February 7th, we did a program on stroke education, life after stroke, and the future in diagnosis and management. And we had Doug Van Houten, RN, and Dr. Ash Jain as faculty. In terms of upcoming programs, on the February 11th, we're planning to give a program that is actually a community health screening. And this is a screening that was started years ago for abdominal aortic aneurysm screening by Morris Hyman. And we're still providing that service. We do some screening by phone first before people sign up to come for the screening. And it is always astounding how revealing that screening is, and out of all the patients, the significant number that turn up with conditions that either need immediate attention or need to be followed. And this is something that Morris Hyman led the way with, and I think it's very unique. There are not very many places where you'll find a screening like this. Dr. Ash Jain will be there, and Dr. John Thomas Mahegan will be there to do those screenings, and this is something they've done together for many years now. And it is a true community service. On Valentine's Day, we'll be having education on the heart of the matter, minimally invasive heart surgery, and nutrition after heart surgery. And Dr. John Cecil Walks, our cardiothoracic surgeon, will be part of the faculty. Lori Roffelson, one of our registered dietitians, and a certified diabetes educator will be there as well. And this event will be co-sponsored by the Washington Township Medical Foundation. On the 15th, we're going to have a program on health insurance options. Make sure your kids are covered. It will start at 10 and end at noon. And Linda DeWall, our Health Insurance Information Service Coordinator, and Chrissy Karakapa, our Health Insurance Information Service Coordinator, will present the program. They will discuss how families who have lost health insurance coverage can qualify for a low-cost health insurance program called Healthy Families. And this is a program offered by the state of California, and it includes medical, dental, and vision coverage for children. It's an important program if you found yourself without the health insurance for your family that you need. On the 23rd of February, we're going to have a program at the Women's Health Center on the subject of getting ready for pregnancy. And Amy Kelly, who's a registered dietitian and a certified nutrition support clinician, is going to talk about the importance of nutrition in preparing for a healthy pregnancy. On the 1st of March, we'll have a program for diabetics. Are you making progress? Setting goals to manage your diabetes. It will be held at 7 in the evening. Vida Reed, our certified diabetes educator, will discuss the importance of setting clear goals and expectations for monitoring progress in managing diabetes. On March 6th, we are going to have a program called Caring for Your Kidneys. We'll start at 1 in the afternoon and go until 3. Nicola Ehrenberg, who is a nurse, and a kidney transplant outreach coordinator with UCSF, along with representatives from the California Transplant Donor Network, are going to discuss kidney disease and transplants. Dr. Lucy Umena, nephrologist, will moderate the program. On the 6th of March, we will also do a program on strokes. This one is entitled Introduction, Stroke and Risk Factors for Stroke. It'll start at 6 in the evening and end at 8. And we will have Dr. Ash Jain presenting, as well as Doug Van Houten, RN. On the 10th of March, we'll be doing more education for stroke patients, and it will be Stroke Awareness Day. We'll start at 10 in the morning and end at 1 p.m. And we'll be relying upon Dr. Jain and Doug Van Houten again for their excellent support of this program. Our foundation, the fundraising arm of the district, held its annual meeting on January 30th, and I'm pleased to announce that the Foundation Board of Trustees approved a donation to Washington Hospital in the amount of $725,157.04. This donation is intended to help underwrite the capital projects at Washington Hospital, including construction of the new facility for the Center for Joint Replacement and the Sandy Amos Outpatient Infusion Center. In addition, the contribution supports the cost of providing mammograms to district residents without the means to pay for screenings. And this has been a long-standing project of our charitable foundation to make sure that everyone has access to a mammogram that needs one. The other areas that received foundation funding were neurosurgery, the Washington on Wheels Mobile Health Clinic, diabetes education, cardiac rehab, the Women's Health Center, and the Health Resource Library. We're very honored to receive this generous gift on behalf of everyone working at the hospital. And we want to thank Demetrius Schaefer, our foundation president, and the entire board of trustees of our foundation. At this meeting, the trustees also presented a $25,000 donation to the George Mark Children's House and Pathways Home Health and Hospice. Washington on Wheels Mobile Health Clinic in this past month made all of its usual and customary rounds. They were at the Fremont Senior Center, the Fremont Family Resource Center, the Silliman Activity Center in Newark, the Ruggieri Senior Center in Union City, and at the NUMMI Reemployment Center that's located in South Fremont. The WOW van also provided health services care to students at Irvington High School, Robertson High School, Breyer Elementary School, and the Mission Valley Regional Occupational Program. In terms of internet marketing, in January, our website had 31,709 visits and 22,621 unique visits, which resulted in 103,917 page views. Some of the links most visited on our site included, not surprisingly, the employment section, with 17,981 page views. The physician finder section with 14,753 page views. The volunteers page with 9,246 page views. The About Washington Hospital Healthcare System section had 8,249 page views, and the Women's Health and Pregnancy section had 2,439 page views. During the month of January, the InHealth staff aired a variety of new shows, including Your Concerns in Health, a program by Dr. Barbara Kostick, who presented information on a good night's sleep, a new Diabetes Matters lecture series entitled Diabetes Viewpoint and Shopping Smart, and a new Weight to Success program, which all aired for the first time in January. Several health and wellness lectures that focus on cough, pneumonia, and why nutrition is key to maintaining a healthy weight were also captured. Staff completed a Diabetes Matter lecture focused on dietary supplements and started a production of the new show on sleep disorders. WHA's department wish list is something that was addressed this past month as well. They allow departments to purchase specific items that are directly related to patient care in their respective areas. A total of 22 requests in the amount totaling $13,000 were received. WHEA funded 14 of those requests spending $6,851. They also sold discounted tickets for the Golden State Warriors versus Oklahoma City Thunder game on Friday, January 27th, and the event was a sellout. And finally, the Employee of the Month for February is Virginia Burko. She's worked as a birthing technician at Washington Hospital for 29 years. She is always aware of what's going on the floor, and she's considered a very good resource for the charge nurse. In the OR, her skills are considered unmatched. The physicians and RNs that work with Virginia know that she renders excellent patient care. Thank you.
Thank you, Nancy. Okay, we're going to move into the quality report. Stephanie, please.
Good evening. Tonight I'm going to give an overview of our Excellence in Emergency Department initiative, and you'll be hearing more about it in the months to come. So as we get status updates, I will bring them forth. The Quest for Zero Excellence in the ED is a risk reduction program sponsored by Beta Healthcare Group Risk Management Team. The whole goal behind the initiative is to improve patient safety by addressing the issues that generate the greatest frequency of ED claims. And if you're not aware of what Beta is, and Beta is the largest insurer of professional liability coverage for over 100 county, district, and nonprofit hospitals and healthcare facilities in California. And if I speak correctly, I think it was started by Washington Hospital.
That would be correct. This was the concept of Richard Warren, our previous chief executive officer, and he is the creator of Program Beta.
Yep. So the whole focus behind the Quest for Zero is to improve reliability and reduce risk exposure in the emergency department. The goal is to have zero errors. The initiative includes 45 hospitals with ED, different size emergency department, and many emergency medical groups in the state of California. The goal of the program is to address the top issues often seen through insurance claim. And this initiative came about in 2010, and hospitals were allowed to begin enrollment in 2011. Washington opted to enroll in 2011. Let's talk a little bit about the program goals. As I said earlier, it is to improve patient safety by reducing preventable, unanticipated events. The goal is to enhance the skills and knowledge of all our ED nurses and physicians. It is also a goal of improving team communication, achieving professional recognition, and the zero part of it is reducing the frequency of claims. Some of the strategies that are going to be utilized as part of this initiative is education, individual chart audits, and this is physician peer-to-peer review. Annual evaluative strategies include simulation, advanced professional certifications, and they're talking about certification for emergency nurses, communication, and quality initiatives that's going to improve the care of patients in the ED. The program has a two-tier structure. Tier 1 of the program is focused on education online learning, while Tier 2 is focused on education plus quality initiatives that are geared towards the emergency department. The focus of Tier 1 is to improve the recognition and management of the cardiac patient population, and that is the goal that has been selected for Tier 1. There is mandatory completion by the end of the first year for the program. And as I have said earlier, our education began in 2011. There are 5 online modules, and examples of these modules are atypical chest pain in women, EKG interpretation, myocardial infarction, and an overview, part 1 2 of risk and patient safety. Tier 2 focuses on our practice as an organization and our risk issues. So it begins to drill down on some of the issues that affects Washington Hospital and the emergency department. It is to look at the performance of our system in terms of how we provide care in the ED as it relates to the individual, the group practitioner, and that whole process that we have in place. There were 3 mandatory learning modules, and these modules are chosen by the Sullivan Group, and it's one of the largest risk prevention group for emergency departments and emergency physicians. There is a selection of quality modules that must be chosen from, which includes simulation, certification, a culture of safety, enhanced communication. So I think there's a total about 6 initiatives that you can choose from. Let's talk about some of the benefits of the program. It shows a demonstration. It demonstrates commitment to the ED healthcare excellence and patient safety, which is aligned with our mission statement, Patient First Ethics. It establishes a baseline competency for all ED nurses, physicians, nurse practitioner, and physician assistants that practice in the emergency department. It helps improve individual and multidisciplinary team communication. It's working together as a whole for the patient. Improve patient safety based on best practices out there, and it improves the quality of patient-centered care. Where are we at Washington Hospital? 100% of our ED staff and physicians have enrolled in the program. They're in the process of going through the modules. The modules must be completed by the end of May. So at that point in time, you will see our results, and I'll bring that forth again. As we move forward to the phase 2 or the tier 2 of the program, Beta has targeted abdominal pain for 2013 and headaches for 2014. We also have an ED Clinical Operation Committee, which comprises of physician and nurses and other staff members that functions in the ED, and they're going to be looking at these results, looking at future benchmark as it relates to education. We have also began to change to some of the practice that we have done in the ED, just based on doing some of the modules. So I'll bring that forth as well. So I think this is definitely a step in the right direction. This is what Washington Hospital is all about as it relates to quality and as it relates to providing the best possible care to our community. Questions?
Any questions? Thank you, Stephanie. Thank you very much. Okay, Chris, we're going to now move to the finance report.
Okay, Joe. Okay, so tonight we'll be walking through the operational and financial results for December 2011. December was a month that was again characterized by some of the volume and service mix challenges that we've been discussing over the last several months, and you'll see that play out as we go through the numbers. Average daily census for December was 9 below budget at 181. We had 14 more admissions during the month than we expected at 1,123, but patient days were 280 below budget at 5,610. Average length of stay based on discharges for December was 4.57. We expected 5.31 in the budget. Looking at utilization, our case mix index for the month was below budget at 1.4. We had expected 1.462. That, of course, being driven by volumes in our OR and cath lab primarily. Deliveries for the month were 12 below budget at 153. Our surgical cases were 42 below budget at 335. That number includes our joint replacement cases that were 20 below budget at 77, our neurosurgical cases that were 3 below budget at 16, and our cardiac surgical cases that were 3 below budget at 10. PTCA procedures for the month were 18 below budget at 49, and cath lab volume overall was 82 procedures below budget at 353. Outpatient visits for the month were 213 below budget at 8,328. And our emergency room visits were actually 73 above budget for the month at 4,321. So the emergency room continued to be busy. Looking at productivity, productive full-time equivalents for the month landed at a little bit over 1,391. We had 190.9 non-productive FTEs for the month, giving us total FTEs 39.1 below budget at 1,582 even. Our FTEs per adjusted occupied bed, which is our productivity measure, showed an improvement from the prior month at 6.87, but still just slightly above budget. Moving into the financials, and as we usually do, we'll look at the Governmental Accounting Standards Board presentation first. For those who aren't familiar with this, this is the presentation we're required to use for our audited financial statements. Total patient revenue for December came in almost $5.5 million below budget at $161,144,000. Our contractual write-offs were pretty close to budget at 74.32%, giving us net operating revenue for the month almost $1.5 million below budget at $41,677,000. Operating expenses for December came in $469,000 below budget. We saw most of that with our salaries and wages and supplies costs. Those were offset by benefit and purchase services costs that were above budget. And of note in December was almost a $600,000 variance in depreciation and interest expense. We saw that hitting the financials early as we did operationalize the power plant early. And as a result, we have to start recognizing the depreciation and interest that had been capitalized on that project started coming to the income statement. So we end December with an operating bottom line almost $1 million below budget at $804,000. Non-operating income for the month came in a little over $1.5 million above budget at $2,776,000. That includes an unrealized gain on our investments of $1.363 million. So we ended the month with a total bottom line from a GASB perspective, $533,000 above budget at $3,580,000. Moving into our Financial Accounting Standards Board presentation, and this, for those who aren't familiar with this, is the way the financial markets look at us. Our operating bottom line stays the same at $804,000. We pull out our unrealized gain on investments and our general obligation bond revenue to come up with non-operating income from a FASB perspective, about $100,000 above budget at $704,000, and a total bottom line from a FASB perspective, $882,000 below budget at $1,508,000. So are there any questions on December?
Questions, anybody? No, please go ahead. Nancy, please, to the operations report.
The operations report for January. The month of January saw 1,152 patient admissions. They resulted in 6,065 days of care. The average daily census in January was 196. This was higher than compared to December's. The high and low census ranged from 211 down to 159, respectively. Our budget for January anticipated 1,144 admissions and 6,093 days of care and an average daily census of 197. We're going to be approximately 28 patient days of care below the budget for the month. In terms of average length of stay for adults and children in January, it came in lower than budget at 4.98, which is not necessarily a bad thing. Our budget had anticipated an average length of stay of 5.33. Our preliminary information on patient mix indicates that the inpatient revenue for the month of January amounted to approximately $134,972,000. This compares to a budget estimate of $136,594,000. Of this amount, 55% was Medicare and 9.7% was Medi-Cal. The birthing center saw 152 deliveries in January. We had budgeted for 171. The deliveries resulted in 334 baby days of care, and our newborns totaled 154 for the month of January. In terms of surgeries, we had 379 surgical cases at the hospital. The budget had called for 364, so we're over budget on surgeries. This included cardiac surgical cases that were 8 below the budget. Inpatient surgical activity was below budget by 12 cases. Outpatient surgeries were above budget by 27. 591 cases were seen at the outpatient surgery center, and this is greater than what they had planned for in their budget, which called for 571. For the month of January, there were 338 cases seen in our cath lab, including 38 PTCAs. These numbers are very low. Total cath lab cases were lower than budget by 28.7%. PTCAs were lower than budget by 47.2%. Inpatient cath lab procedures were 43 fewer than anticipated in the budget, while outpatient procedures were 93 lower than expected. In terms of non-emergency outpatient visits in January, we had 9,169, and this was above the budget that had called for 9,129. The emergency room recorded a total of 4,544 patients, daily average of 147, and they came in 189 visits above budget. The Washington, Warm Springs, Newark, Nakamura, Ohlone, and Walmart clinics saw approximately 3,849 patients during January. Our total system emergency room and clinic visits for January total 8,393 compared to a budget of 9,296. In terms of personnel, we were able to get some greater control over personnel utilization in this month. Full-time equivalents for the month of January totaled 1,605.9. This was lower than the budget, which called for 1,674.1 FTEs. FTEs per adjusted occupied bed were 6.53, which was below the budget of 6.63. In summary, we had 8 more admissions and 28 fewer patient days than anticipated in the budget. Surgical cases are above budget by 15. Cath lab procedures are below budget by 28.7%. Outpatient visits for January are 40 above budget, while the ER visits were 189 higher than we had anticipated. Clinic visits for the month are below budget by 1,092. Total paid FTEs are below budget for the month, and FTEs per adjusted occupied bed are also below the budget. The inpatient charges for the month were lower than budget by approximately $1,622,000. Our outpatient charges were also lower than budget by approximately $3,890,000. Total hospital charges for January are below budget by approximately $5,513,000, or a 3.2% negative variance. On January 31st, there were 159 days cash on hand. The total days revenue in accounts receivable at January 31st was 72.83. The days revenue in accounts receivable excluding Medi-Cal was 59.23. During the month of January, $1,133,000 of charges were approved for our pending charity assistance. And on a further note, I wanted to mention that last week the Department of Healthcare Services, State of California, announced a short-term payment delay to Medi-Cal institutional providers due to what was characterized as a severe cash flow shortage. As a result, the payment scheduled for March 5th and March 12th will be held for payment on March 19th and March 26th. This is in addition to the slowdown in the state's approval of cases for billing that we've been experiencing since early December. The impact of this slowdown in payment has resulted in an increase in the already high days in accounts receivable for Medi-Cal from 123.6 days in November to 151.5 days as of January 7th.
Nope.
Thank you, Chris. Thank you, Nancy. Okay, we have already considered the action items. We're having a closed session. Brief closed session. Thank you all for coming. We're going to adjourn now to a closed session of the board. Reconvene the open session and announce that there was no action taken during the closed session. And is there any other items for this evening? Okay, this meeting is adjourned. Thank you.